Powered by Riverside.
Hi, everyone, and thanks for joining us for another episode of Leadership Bytes podcast, where we share inspiring and empowering stories of current and emerging women leaders across diverse career stages, industries, and backgrounds. Today, we are welcoming Dr. Erica Fischer-Cartlidge, the Chief Clinical Officer of the Oncology Nursing Enterprise, which is the premier association for more than 100,000 oncology nurses in the United States. Erica leads initiatives in clinical practice, research, advocacy, and community engagement, focusing on enhancing the care experience for cancer patients through evidence-based practices. As a principal investigator, she's championed equitable care initiatives for diverse patient populations, and with numerous accolades, including the 2021 Connie Henke Yarbrough Excellence in Cancer Nursing Mentorship Award and recognition as one of the Association for Value-Based Cancer Care's 40 Under 40, Erica holds degrees from the University of Scranton, Drexel University, and Quinnipiac University. So I'm so excited to be with her today, and I really look forward to our chat. Thank you so much for joining us, Erica.
It's my pleasure. Thank you so much for having me.
So we're going to just dive right on in here, and I'm going to ask you to get us started by sharing a bit about your journey into oncology nursing and what attracted you to this specialty.
Sure. I think for a long time, I always knew I would be in some type of service industry, particularly healthcare. I was an informal caregiver to a whole gaggle of cousins, of which I'm the oldest as I was little. But I never really intended to go into oncology. I wanted something that was fast paced, always changing. I had it in my head I was going to be in the emergency kind of field. And as I was doing my clinical rotations, I happened upon a patient who was a breast cancer patient, post-surgical. She had been a caregiver for both her mother and sister who had had a cancer diagnosis. And I was a probably 20-year-old overeager student who had just learned about some side effects of cancer in one of my classes and had this dialogue with her and was like, well, this is kind of your third time going through it, first as a patient, but we've been a caregiver. So are you familiar with this? And are you familiar with that? And she had never heard of it. No one had told her any of these side effects that could happen to her after surgery. And so I remember going up to the nurses station and saying like, well, where's your patient education materials on this? And they didn't have anything. So on my lunch break, I went to the library in the hospital and I printed stuff off the internet for her. And when I went back and gave it to her, she started to cry. And I had this moment where I realized that while the emergency department is fast paced and exciting, and I would probably love that this impact you can have in someone going through one of the most challenging kind of times of their life is far deeper and the relationships are more meaningful. And so I fell into it. I never looked back. I wish I remembered that patient's name so she could know what an impact she's had on so many people's lives, as my kind of journey has unfolded. I think it's a real testament to kind of not getting so honed into what you think your story is going to be and really, kind of following where it takes you.
I love that. And you've been really instrumental in embedding evidence-based practice within oncology nursing. And you've now taken a turn in your career. You are still supporting oncology nursing, obviously, but you are also now an association professional, sort of working for the professional organization that supports nurses in this space. So how have you been able to take that background in evidence-based practice and transition that into your work as an association professional, leading staff in supporting the organization?
It's a great question. I think there's a statistic out there that it takes an average of 15 to 17 years for good research to become our standard practice. And I think when I learned that, I was horrified by it, that it could take so long for us to do the right thing. And so I really threw myself into, at the clinical level, kind of being a change agent, learning how to do change really well at the clinical level. And I was doing that in my roles in the hospital setting. I was doing it a lot, and I became really good at it, which is hard to say. It's not always something easy to kind of recognize about yourself. And I wanted that impact to go farther than just the organization I was working in. And so when I had the opportunity to make a change into the association space and kind of have that kind of ripple effect be much more substantial, it was really a great opportunity to say, okay, we know how to do this and we know how to do it well, but it's still not good enough to only do it at one place. Like, how do we make sure that every book you get from your professional association is steeped in the best evidence and it's the most current evidence? How do we make sure every course you take when you're trying to advance yourself is the most progressed, that it's really considered all the controversies out there in the evidence and done that the right way? Because a lot of people throw the term evidence-based around right now, but the truth is, some people use one article and say, oh, this is evidence-based, and that's not really doing it the right way. So really looking to have that impact be much more pervasive.
That is so powerful. And as someone who has worked in associations for a really long time now, I think about the impact that these organizations have on society. And I think your story is a real testament to that. You were making a difference where you were, but you saw associations as an opportunity to expand that impact, and you're doing just that. Do you find, as you work with your staff, you are more focused on outcomes and data, and that's driving your organization in a different way because of that background?
I think it does. I really love data. I think that it's hard in my field, if I'm being honest. Nurses are often driven by feelings and emotions. And so, kind of having that shift to say that's important, but you have to back it with the data, because the data is the language everyone speaks, right? And as a clinical person, even I remember doing this, coming out of a room and saying, like, my gut says this patient's not doing well. Well, in truth, it's not really your gut, right? It's your ability to process the data of that patient so quickly. And you're not always able to put your finger on it. And so that's something that I've really worked with my team to, like, translate, even though inside you know the way to do it. Like, you have to translate it to the language other people speak. And in an increasingly financially challenged environment, that's also being able to speak the dollar and cents language. Like, how do you translate that data to patient outcomes? How do you translate it to nursing outcomes, so that you're speaking a universal language with administrators, financiers, and in my world right now, the other association leaders who aren't nurses.
I love that you bring that up, because for a lot of professional membership organizations right now, one of the challenges that many of us are facing is how to get support for professionals in different fields, whether it's healthcare or education or whatever the field is, how to get support for them to be able to join and access all of the resources and things that our organizations provide, providing that data and that, I'm going to use the term again, evidence based information is so important. So thank you for lifting that. How are you all doing that at the Oncology Nursing Enterprise? Are you seeing success with membership, or are you sort of hitting a wall there, with trying to justify membership and expenses for folks?
So there's three corporations that make us up. Each one of them has a different approach. The Oncology Nursing Foundation is our philanthropic arm. They are looking at how do they translate their work into scholarships and people kind of getting that next level of education, research grants, and what are the impact of those research grants they provided. So for them, it's sometimes even more straightforward to be able to translate that. For our credentialing arm, the Oncology Nursing Certification Corporation, they do a really great job of engaging across the credentialing world to translate, why does that validation of knowledge and skills matter so much? What does it mean to the public? What does it mean to patient outcomes, to confidence in that space? I think the membership world for us at the Oncology Nursing Society is a little bit more challenging, in that there are so many facets of it, right? There's the community aspect that you get from coming together and being a member of something, and the networking piece of it. And that's often challenging to kind of tag a data point to, like, what did you walk away from? I made 17 new connections. People don't think like that necessarily, but they feel like they're part of something bigger. There are different resources we provide that are a little bit easier to quantify. So our chemotherapy, immunotherapy training course is something that many organizations require before you can hang chemotherapy. And so to really look at what that standard is, how you make sure someone is ready to practice, defining competencies, I think those are all places we look at. But engagement is so hard to quantify nowadays, particularly in a very digital era. Like what someone clicks is often counted as an engagement, but are they really engaging truly in the way we think of it as a human?
I think that's such an important thing to realize is that what makes connection valuable is different for everyone. That leads into a question that I have about your work in equity. You have been a person who has really emphasized the importance of equitable care for diverse cancer patients. And as a Black woman in my family, there have been different family members who have had cancer, and some of them survived, some have not. And the care aspect of it is so important because we know that care is not always equitable, right? And I'm curious what your thoughts are about initiatives currently in place to address any disparities in oncology nursing, and how can our listeners get involved and help support, equity of care in these settings?
It's such an important question. I think it comes from a lot of places. The bulk of my clinical practice happened in Manhattan. We had an incredibly diverse patient population that I saw. I knew the statistics. I knew the data that less people of color were getting cancer screenings. They were getting diagnosed later, that a lot of misconceptions and historical feelings around healthcare environment contributed to those things. But I don't think until it really directly was like in my face, in a very personal way, did I realize the gravity of needing to act on it. My husband is a Black man who has all the feels about healthcare that you read about. Our son is biracial, and every time he has something on his skin, it is challenging to diagnose. From when he was a baby and he had, a very complicated diaper rash that didn't look like any of the pictures. And, between us and our pediatrician's team as well, we think it could be this. Let's try this. He had hand, foot, and mouth syndrome, a very common thing kids get, but it didn't look like any of the pictures and it didn't look like any of the kids in his class. So he got diagnosed so many days later. And we realized it was just because people are not trained on medical images that reflect what society looks like today. And for him, it's a diaper rash, it's hand-foot syndrome. It's not critical. But when you look at patient with cancer and a side effect related to their treatment that could be catastrophic if you don't catch and deal with it early. Some cancers present on the skin, both skin cancers, but also inflammatory breast cancer can present on the skin. If you don't know what that looks like in someone that's not fair skinned, you're going to miss that. And so really that became very personal for me, to say, why haven't I acted more aggressively in this space? My patients of color were presenting a little bit differently, but I don't think I thought, well, I need to do something about this. And so one of the things when I came into ONS that we started to really think about right away is making sure that all of our images and our education and resources have really a more diverse set of skin tones. And then we realized, well, that's a problem because they don't exist. They're not out there. And so we have started to curate these different images on a full spectrum of skin tones to make sure that we can provide appropriate education and resources, looking at how we can do that and provide them for people to educate themselves, but also as we're educating others. And we just launched a case series, 5 different case examples. We showed some common cancer toxicities on different skin tones, and we quizzed people about what they were, how severe they were, what they would do. And we found that more than 50% of the people that took them didn't get the questions right.
Wow.
And what that really told us was that we get it. What we think is a knowledge deficit out there really is a knowledge deficit out there. But we also saw the highest digital engagement with the case series that we have seen in any similar thing that we've put out that way, which also told me people really need and want this. And so that really was very validating to know that, this isn't just in our mind that we think people need this. We know that most medical providers, when they're educated in school, don't have exposure to a lot of different ethnic backgrounds, depending on where they go to school and where they live. Where they train can very significantly impact. And that when you go into textbooks and most medical education, the primary images that you will see will be on someone Caucasian. And so that's really something that we're trying to lead the charge in from the Oncology Nursing Society to say, not enough. Like, we need to figure it out. We need to fix it. And so we're partnering with some healthcare organizations that are willing to capture and de-identify these images on really important cancers and also side effects of cancer treatment so that we can do better.
I love that, Erica. That is such important work. I mean, way to go, ONS, right? That's so good, Yeah, and I love it because a lot of organizations talk about DEIA plus and the overarching principle of it, which is great. But I love it when an organization and the staff can point back to, this is what we notice, this is what we're doing, and this is how we are being the change that we seek. So thank you for that. And thank you, ONS, for tackling such a big and important problem. That's amazing. And so I want to talk a little bit about you as an educator and a mentor. How are you inspiring your team in this important work that you all are doing and helping them to develop as leaders as well?
That's something that I feel really fortunate and passionate about. I had an unofficial who became an official mentor early in my career who did what I would call the continuous shoulder tap. And she would say, hey, are you going to that program that they're offering that, today you want to walk over together? And things that early in my career, I wouldn't have thought that I should go to, or, are you a member of this professional association? Why don't we go to that meeting together? And she kind of was always like leading me in the direction that I didn't know I needed to be. And that kind of begetted the next opportunity to be on a board or go, volunteer here or be more active in this space. And so that's something that I really think a lot about as a leader, tapping them on the shoulder to say, hey, do you want to go to this? Do you want to have this opportunity? Because I know that sometimes we get heads down in our work and we don't think about those things where it's, well, that's a nice to do, not a need to do. And so as a leader, it's really important to give the tap on the shoulder and say, I see something in you. I see an opportunity for you that you may not see for yourself, and give them the space to carve it out and really go get it. On a one-to-one level, I try to make sure that as we're setting goals, we're not only setting goals for the work we want to do in the organization, but that we're also setting some goals for ourselves personally, what we want to do, what we want to accomplish. In a very full plate of work, what's the piece on there that lights your fire, right? As your flame is sometimes dwindling in a very busy work day, like what's that one project that lights your fire that you are choosing versus kind of having chosen for you? And so I think those are really important pieces. But perhaps beyond the tangible, it's just really leading authentically. When I come to work, I come as myself. If I'm having a bad day, I declare it right at the beginning of the meeting. Like, I'm grumpy today, guys. Here's what's going on in my life. It's been really stressful. If I'm having childcare issues or my son is sick, like, I don't feel like I need to quarantine that away. I show up as who I am. I give them what I can give them for that day. And I allow them the space to do that for themselves. They're really upset about something. They know they can come and let it fly with me, and it doesn't change how I see them as an employee, as a deliverer, as a person, that I'm going to come up and be who I am. And I want them to be that for themselves, because I think that when you can lead with humanity, you really inspire people to be the best that they can be in that sense.
That's wonderful. Your staff is very lucky to have you. So, Erica, is there anything that you wish you had known before you stepped into leadership roles? And if so, can you tell us a little bit about what that thing is?
Yeah, I think I wish I had known that it's okay to set some boundaries for yourself up front. When I came into what I consider my first leadership role, it was a position where I influenced without authority. So individuals didn't report to me, but I had an important kind of influence role as a clinical nurse specialist. And I really wanted to show my value. And I think even as I went into more formal leadership roles, every time you're a new leader in a space, you want to show your value to the people. And in doing that, I think sometimes we let some of the walls down, right? Like you'll take a meeting at any time somebody wants to put it on your calendar. You're responding to emails when you're on vacation because you don't want people to question your dedication or whether you can do the job or can you meet their need. And I think for a lot of years I got into some really bad behaviors where I was over accessible. People maybe weren't trying to solve for their problems themselves and realize that they could, that my work-life balance got truly out of control. And kind of in a more tenured place in my leadership journey, I recognize now that it's okay to set calendar boundaries. And if there's really a reason someone needs to meet outside of that, that's okay, but it's not a free-for-all, right? That it's okay to disconnect and model that. I really aim to model work-life balance for my team. I don't expect them to respond to me when they're on vacation. And in that handoff, they don't expect me to be responding to them when I'm off. And so I think I really learned that you have to model the way in that space, but that it's okay to say your life outside of this job matters. And even in very high positions, that it's okay to do that. Like, are there emergencies and things in that nature? Certainly, more so when I was in the hospital space than in the association space. But it's okay to kind of set some of that protection for yourself.
Just terrific advice. And I'm curious about what skills you think are really important for leaders right now.
I think today, one of the most important skills you can have is the ability to be agile. And I think that's a sink or swim place to be. If you can't see an ever changing environment, even if you're not in healthcare, but particularly if you're in healthcare, things are rapidly changing. But I think that's really everywhere right now. I don't think it's unique to our space. You have to be able to see the trends, keep your pulse on them, be willing to pivot. And with that agility, I think comes taking calculated risks. Things don't need to be perfect before you try them. What's the minimal viable product that you can kind of experiment with to learn from? So I think that's really critical today, to be relevant and is really to be agile. I think the other thing, and I smile as I say this because I think this is maybe not a popular opinion, but that the higher you get and the more strategic your role is, you need to be able to still get in the weeds. And not often, but I think you have to be able to lay down and be in the weeds with the team, understand the struggles that they're going through, what their day-to-day experience is, and then be able to get back up again and think at the 100,000-foot view, set the strategy but doing it from a truly informed place. And for me, I think that's something, some people get in the weeds and they stay too much in the weeds, right? And that's I think really troublesome for a leader. But some people just stay too up in the strategy too much, I think. And I think a great leader has to be able to move between, to represent their teams, but to best really set a strategy. If you don't know the barriers that exist, you don't know the things that really drive the individuals who work for you, I don't know that you can truly set a successful strategy. And so I think that's really critical, the ability to kind of move between those two levels.
Terrific. I could not agree more. That resonates so much with me. It's got to be a balance in all things. And what keeps you motivated, Erica, in your work? And how do you balance the demands of what is obviously important work in your role with your own personal health and well-being?
I think what motivates me is I love a good challenge. I've never kind of set out to say, I want this position next, or in 5 years, that's what I want to do. I've really always said I want to be challenged. I want to feel like the work I'm doing is meaningful. And when I start to feel like I've mastered something, I look at, okay, well, what could be coming that's going to give me the next challenge? So I think what motivates me is being challenged, taking new things on, and really learning new spaces and skills. I think what helps me stay balanced is, I'm not sure I do it great yet, but I'm working on it every day. I'm a mom to an incredible 4.5-year-old who keeps keeps me always remembering how important the balance has to be. And so I think sometimes having something that's right in front of your face, that work is not the only piece, is really important. I try every day this year more than ever to create space for myself, to create dedicated space for my husband, to create that family space. And I think it has to be intentional, much like most things. You have to schedule that time to do it, because otherwise it's very easy to, just pop on the couch and throw the laptop back open at the end of the day. So I always make sure I have a good book that I think, how many days this week have I, taken time for myself? What has that looked like? Has it been the quick coffee with a friend, before the day gets started? Is it just, carving out a couple minutes to read a chapter for myself and not apologizing for it? Just being able to say, like, I need this time. I need to download for a second, and not feel the need to apologize for it.
Yeah, that's great. You've won so many awards and been recognized in so many different ways. Which recognition has been the most meaningful to you and why?
That's a really hard one. A really hard one. It might be a tie. And I think I would say the 40 under 40 is one of them. And the reason is because for a long time in my career, being young wasn't an asset. I came into a lot of leadership roles in a much younger place than the people around the boardroom tables with me. And I would often hear things like, well, I could be your mom, right? Or you have so
Oh
much time
gosh.
to do that. You're such a
Yeah.
baby. And people don't mean it to be negative, right? But the underlying message there was always, you still have time, you have a lot to learn. Maybe you're not going to be as deep as a contributor as someone with more time. So to get that recognition, I think to me said, you can be successful and you can do all those things without the number of years. And so that was really important to me. But the other one really was the mentorship award, the Connie Henke Yarborough Mentorship Award, because I know for me what it meant to have someone invested in growing me and my success. And so that is always something that I've wanted to pay forward. So to have someone take the time to say, I see what you do, and then complete an application for an award, I think really in that space meant something tremendous to me, because I don't do those things to get recognition for them. I do them because I know what it meant to me, and I want to see someone else have those wins and that opportunity. So to be seen for something like that, I think is really immensely meaningful. I mean, if you've never gotten an award or nominated someone for an award, I will say that's your homework, is to look around you and really see the people that you interact with, because there is nothing more impactful than knowing that a peer took the time to do that work that they didn't have to do, to recognize what you're doing. So I would say I challenge everyone, if you've not done that for someone that you really think is fantastic, to find the space to really recognize them. Even if they don't win it, just being nominated is really quite an act of service to someone.
Yeah, I love that you highlight that because, what I see is there are lots of awards, there's lots of recognition, there are lots of opportunities for folks to be seen. And I think sometimes there can be the temptation to sort of get caught up in all of that, wanting to be seen rather than, getting in there and being focused on doing the work. What advice would you give to young professionals in particular? I'm not saying it's only young professionals that deal with this, because it's not, but I'm curious about specifically for emerging leaders. What advice would you give around that, and how did you stay focused? How'd you master that?
So I think I would say it's say yes and don't think about anything else, right? For a long time, I said yes, even when my plate was full. And you'll hear people say, no, the greatest advice is to say no, right? I like to think if you're building a career, you want to think about this like getting on the highway, right? And what do you need to do? You need to accelerate into the flow of traffic. You go from the on ramp, you accelerate into traffic, and you need to get into the flow before you can put cruise control on. You really need to look at where you are in your career, and you need to know, am I on the on ramp to my career, or am I in the flow of traffic? And do I want to stay in the flow of traffic, or do I want to be leading it? And I think that really, if you are on the on ramp, if you are looking to get ahead of the flow of traffic, then you say yes. And you say yes to every opportunity that comes to you, because I mentioned before, I never sought a specific title, right, or a position. But when they came, I had a really great CV that had unique opportunities. They were diverse. They touched all different kind of spaces in healthcare. And eventually they all really came together. And if I was like putting an umbrella over them, it was change. I do change well. And that's something that I think can be intimidating to people. But is to say yes, because the one yes gets you the networking and the person that gets you the next opportunity and it gets you this. And so say a lot of yes as you're on that on ramp, and don't be afraid to have a busy plate. It's okay, because you really want to get into the flow. And then you get to be more choosy. Once you're in that flow of traffic, you get to be more selective. You can pare it down. But I think you want the opportunities to keep coming. And that comes from saying yes, so that then you can kind of tailor your approach. And that would be the greatest piece of advice, I think, for somebody who's kind of building it. I think at any stage of your career, I would say don't be afraid to ask for what you need. As women in particular, we often think we need to do it all on our own, or that if we speak of an ambition or a goal out loud, it makes us selfish. It's okay to say it. It's okay to have ambition and goals and say it. And I would say you need to surround yourself with the people who lean into your success with you, but are not going to be the ones who just pat you on the back. Some of the greatest advancements I've made personally and professional were because I had people around me that weren't afraid to tell me the things that were less savory, right? And that I needed to change, that I needed to shift, the hard hears. And so surround yourself not with one mentor, but with a board of people that are committed to your success, but also aren't just going to tell you what you want to hear about yourself, tell you the hard things. And I guess the last thing I would say about that is to be bold and dream to have it all. Are you going to feel like you can do it all? Absolutely not. I have a healthy amount of mom guilt that carries around on some days. I have days where I feel like, oh my gosh, am I really doing everything I want to be doing professionally in this space? And that's okay. If you feel like you're doing everything great all the time, you're probably not doing everything you're doing. But if you're not dreaming for the big stuff, you're selling yourself short. And so I would say really be bold. Dream to have it all, even though it may not all be perfect.
Yeah. Oh, that's great. And I'm going to pivot a little bit back to oncology nursing and ask you about the trends that you foresee shaping the field of oncology nursing, and what advice, if any, would you give to upcoming nurses in the field?
Yeah. There are a lot of things happening in this space right now. And, innovation is the name of the game. Both in drug development, we are seeing a drug pipeline that is like no other. The number of new agents coming in that are the first in their class is massive. There's more oral and injectable treatments where, we really used to think of everything being IV. And so I think the ability to learn on your feet, potentially the first time you see the order and you have to give it, it could be the first time you've ever heard of that class of drug. So relying on yourself, self-education, knowing that change is just going to be a part of your world and getting comfortable with it, I think is going to be important. And then the second, I think, trend is really the integration of new technology, certainly AI and all of those spaces into the environment. And right now, I hear mixed feelings. I hear people saying we can't trust it, or people saying it's going to take my job. It's never going to replace nursing. It hopefully replace the tasks that are not the things that we want to be spending our time on. But I would say you got to be at the table, and your voice matters. Well, I don't care if you've only been in the space a year, 18 months, your voice matters. The work you do matters in shaping that technology and how it's integrated into the field. So the sooner you get involved in professional associations and volunteering and in those, and get your voice into the mix so that you can be well represented and the work you do can be represented in those technology integrations and into those changes, the better. Don't sit back and let change happen to you. You really need to be a part of shaping it.
Love it. Erica, this has been such a rich conversation. I have really, really enjoyed talking with you and all of your insights and wisdom that you've provided to our audience. So I'm going to close with just asking you, what do you have coming up? Is there anything in particular that you'd like to share? Any upcoming initiatives or things that you're working on that you'd like to share with our audience? And if people are interested in getting to know you better or want to follow your journey, how can they stay connected with you?
Great. Oh, that's a great question. I will say this is going to be a banner year for us. The Oncology Nursing Society is celebrating 50 years. So we have a lot of really exciting things planned for the year, both digitally, interacting with us digitally in our space. Our annual conference in April is going to be just a really amazing celebration of 50 years of oncology nursing, and the evolution of that, as well as kind of how do we plan for what's coming tomorrow. And along with that, we have launched an Oncology Nursing History Center. So, really thinking about what are you doing today that's making history and legacy and how we can capture that. So, I think those are a couple really exciting things. I always welcome the opportunity for a great connection. And I think LinkedIn is the best way to find me there. It's the really long, obnoxious hyphenated last name. There's not too many Fisher-Cartlidges out there, but it does make me easy to find. And I think that's a really great space. Some of the work within my portfolio is community engagement, both digital and our volunteers. And so if you're a nurse, an oncology nurse, and you want to get involved and engaged, we want to have you. Your voice matters, and we have a lot of great opportunities now and coming up where you can get involved. And if you're not an oncology nurse, that's okay too. We want to engage with you because the truth is, at some point in your career, regardless of what you do, you're going to interact with someone who's had cancer or has it. And so really understanding that population and how to care for them is more and more important every day.
Wonderful. Thank you so much, Erica, for your time today. Again, it was my pleasure to connect with you. And I know this has been a rich experience for our audience to learn more about you, more about the work you do, more about ONS. And listeners, thank you for joining us again for another episode of Leadership Bytes. And we'll be back in 2 weeks with our next episode. Thank you so much.